Taking care of our mental health is more important than ever. The options to get help are more varied than ever. Dr. Chad Mosier, Clinical Director of Outpatient Services at Palo Verde Behavioral Health, is here with us to discuss today. Doctor, thanks for being with me. My first question to you is, what kind of outpatient services are available there at Palo Verde?
Thank you so much, and it's a pleasure to be here this morning. We have a couple different types of programming here. We offer intensive outpatient programming and services, which means that they meet several times a week for several hours to cover important topics in depth. We offer those programmings for adolescents 12 and up, and also adults 18 through the spectrum of age. And so we're really excited to be able to offer telehealth right now in these times and be able to make our services super accessible.
Yeah, it's very important to make that available to as many people as possible. And so describe what that process is a little bit of getting assessed for services without actually having to come into the hospital.
Absolutely. We have a telehealth intake process. People can do this through calling our main number and setting up an appointment, or if they're in crisis, they can, of course, call in at that moment too. They will be assessed for whether they should come into our outpatient program or whether they might benefit from our inpatient programming. Everything is done through a Zoom platform remotely, and all of the instructions are given to the potential clients as they call in. And so everything is done very professionally and ethically through this platform so that people don't have to come in and join the intake in person. They can do this from home or wherever they're at.
And so when somebody, the right option for them is an outpatient service or services, what does the telehealth situation look like for them? Describe it a little bit.
Yeah, so the telehealth option is similar to what we're doing now, except with some video component. So whether you're adolescent or adult, you would be in a secure location, either your home. Some people have driven out to the library to get Wi-Fi service, and that's one of the things that's really important, is making sure we have good Wi-Fi connection together and internet connection together. And so people will log into a website using a password or passcode, a room code, and jump into that room from the comfort of their home or wherever they're at. They will get the delivery of the group material to them through our facilitators. For example, I'm an adolescent facilitator at night, and so I will have 6 to 8, sometimes 10 adolescents in my group, depending on the cohort, and they will be at home logged in through their phones or laptops or computers, and will be able to benefit from receiving therapeutic information, talking about concerns, any problems that are going on. There's a lot to discuss with everything in the world now, so we offer a lot of support and resources for people as well. And they can just log in, join the conversation, connect with each other, see each other, and communicate with us therapists.
It couldn't be easier. And so sometimes, depending on what's going on, an option is intensive outpatient services. Describe what that is.
Intensive outpatient services really involves 9 hours of commitment of group a week. And so that is 3 hours per session, 3 times a week. And it sounds like a big commitment, and I assure you that once people get to the end, they realize they could still use a little bit more sometimes, just because it's stuff that often people don't get to naturally talk about or learn about. And so 9 hours a week. We also have a little bit more intensive service, which is called our partial hospitalization program. That is offered to adolescents and adults usually between 20 and 25 hours a week. While we were in person, we were able to serve meals to folks. Now that we're not, we offer as much resources and support as we can through telehealth. And we've been successful in delivering that for both civilian and active duty folks, by the way, who are also on base and trying to access services through the base. And so we offer these different types of intensive services, sometimes as part of their initial plan or sometimes as part of their plan from the inpatient hospital. So it's really a large continuum of care, and people can access different types of services within that. After they're done with our partial hospitalization or intensive outpatient program, we try to graduate them from our program and move them into the next level of care. Sometimes that might mean community supports or individual counseling and med management services. We do the best we can to link them up with services out there in the community.
Well, like you said, more than ever, we need to be taking care of ourselves, take care of our mental health. It all starts with making that phone call or visiting the website. I'm going to give that to them in just a moment. But, Doctor, thank you for everything you're doing and your focus on mental health. Thanks for joining me.
Thank you so much for your time, and I appreciate your help.
Palo Verde Behavioral Health is open 24/7 and is available for free assessments for adolescents and adults. For more information, call 520-322-2888 or visit paloverdebh.com.